A hernia is essentially a hole in your muscle or tissue that happens when an internal organ pushes through a weak spot in that tissue. In today's Your Healthy Family, I'm showing you how doctors at NCH Healthcare System use robotic surgery to repair hernias through just tiny incisions. And because this story does include some surgery, there is some graphic video you'll be seeing.
A hernia is just a hole. It's a hole where one shouldn't be.
And Dr. Robert Grossman says one way to repair hernias, using this robot.
I mean, the things that we can do on here are mind-blowing.
Install the endoscope for targeting.
This patient's hernia is right near her belly button. Dr. Grossman says she had a prior surgery and developed the hernia where her incision was,
Which was causing her some pain and discomfort. So what we're doing today is just fixing that.
I was inside the OR with Dr. Grossman for the procedure. He can sit in the corner of the OR, look through this console, and do the operation using the devices you see on his fingers and the pedals at his feet.
All right, let's see.
If you're squeamish, you may want to look away because I'm about to show you what a hernia looks like.
There's her hernia. That's it.
What typically causes hernias?
There are a lot of different causes. In this individual's case, prior surgery, which you can have up to a 10% risk of hernia formation from a prior surgical procedure. Some people are just genetically predisposed to form hernias. Obesity is a major risk factor, chronic straining, coughing, etc.
He says they're doing some kind of hernia procedure at least once a week at NCH. Before this kind of surgery, doctors would have to open patients up to fix hernias.
If you look about a month out, the outcomes for open and robotic are pretty similar, but for an inguinal hernia done robotically, your pain level is so insignificant by comparison that people are back up to normal function within just a matter of days.
So let's talk about how he'll fix this patient up.
We'll do a 20 by 15 centimeter piece of mesh.
Dr. Grossman says mesh is the gold standard for hernia repair.
Many years ago, we used to simply stitch the hernia shut, but that puts the hernia under a lot of tension and it has a high rate of recurrence.
They still stitch the hernia shut,
So we're going to cinch this up to close that hole now.
but once they do that,
Yeah, so that's our hernia repair. Hernia's gone now.
Dr. Grossman places the piece of mesh behind it.
The function of the mesh essentially is just to add a new addition to the abdominal wall to make it a little stronger.
And he says with this innovative piece of technology,
I don't think we'd be able to do them as successfully without the robot.
and listen to this, while Dr. Grossman was operating on this particular patient, he actually found another area he said looked weak and was likely to become a hernia. So he treated it right then and there to avoid any other future complications. For Your Healthy Family, I'm Lisa Greenberg, and for more health stories, head to fox4now.com/yourhealthyfamily.